Today I'll be discussing the negative effects that tanning beds have on your body, especially the skin. Did you know millions of people flock to the local tanning salon where in a matter of minutes they build a beautiful bronze body? Interesting enough, indoor tanning all started in association with medical research. The first UV tanning lamp was actually developed by a German medical company back in 1906 for the treatment of rheumatoid and calcium deficiency. Have you ever wondered what the afterglow of having a bronze, radiant body from a tanning bed was? Have you ever seen somebody that was red as a beet coming out of a tanning salon? Did you laugh, or were you concerned for their health? Well, the U.S. Department of Health and Human Services and the National Toxicology Program say the UV radiation is the most prominent and universal cancer-causing agent in our environment. Shocking, huh? I grew up growing into tanning beds thinking it was a great way to stay tan all year round. Well, that is until I was diagnosed with a skin cancerous mole on my right hip that had to be removed. This information that I'm giving you is important to anyone that plans to use a tanning bed or that is currently using a tanning bed. Consider that 55% more women have a greater chance of getting skin cancer or some form of illness from a tanning bed. The number goes up to 150% of women who are in their 20s. The information is provided from research from the Journal of American Academy of Dermatology. Before one can discuss harmful effects of tanning equipment and increased sun exposure, one must be familiar with the components of ultraviolet light and how it affects the skin. Sunlight contains two types of ultraviolet light, UVA and UVB. UVA rays consist of longer wavelengths that penetrate deep into the dermal layer of skin. Limited exposure to UVA rays cause skin to tan. However, most experts agree that overexposure to UVA can lead to other long-term skin damage. UVB rays, wavelengths are much shorter, affecting the outermost layers of skin. UVB rays are known as the burning rays and are considered more dangerous. Tanning beds and sun lamps generally emit 93% to 99% radiation, increasing the benefits of a tan. This is 3 times the UV radiation that the sun gives off. It is also important to know what happens to the skin as it is tanned or burned and what the long-term harmful effects can be. UVB rays are mostly responsible for a skin's burning. The rays actually pop the capillaries just beneath the surface of the skin. UVA rays have totally different results on the skin. As UVA rays penetrate into the skin, melanin granules are oxidized and skin are turned golden brown. UVB rays, however, are required to stimulate these melanin granules to rise to the skin surface, especially in skin that possesses small amounts of pigment or melanin. Tanning is also skin damage. Although skin cancer has been associated with UVB radiation and sunburn, scientists say that even tanning in moderation produces some harmful effects, as with a burn. Tanning causes premature aging, causing the skin to appear leathery and wrinkled, and also damages the immune system. Long-term effects of UVA rays include premature aging and wrinkles. The Food and Drug Administration lists tanning beds as possible health hazards, and the FDA and the Centers for Disease Control encourage people to avoid using tanning and sun lamps. Even the American Medical Association and the American Academy of Dermatology are fighting to ban the use of tanning equipment except for medical purposes. Both types of UV radiation can cause damage to blood vessels, allergic reactions, or even eye damage. According to the CDC, tanning beds create problems in areas such as conjunctivitis or canal infections. Ultraviolet rays can cause serious damage to the cornea and retina. A study was conducted in Sweden where 14 to 19-year-olds were surveyed. 44 of the participants reported that they had received sunburn from a visit to the tanning bed. Following the study reported that 23% of these students who used suntan beds had reported having diseases such as eczema, psoriasis, and acne. Students proved this exposure to UV radiation is a risk factor for cutaneous melanoma. One study reviewed that approximately 80% of radiation emitted by tanning lamps is the UV range, providing tanning beds to be carcinogenic. Another source study of Caucasian women with melanoma reported that women who had a history of sunburns had an increased melanoma risk. The scientists who conducted this study agreed that although the amount of evidence regarding the harmful effects of tanning lamps have been limited, it has recently been decreasing. They concluded that it is highly likely that lamps cause DNA damage that is directly related to the development of skin cancers, cutaneous effects, and damage to the immune system. The 3 main types of skin cancer, basal cell carcinoma, squamous cell carcinoma, and melanoma, is caused by exposure to UVA radiation. Previously, UVA radiation has been used to prevent vitamin D deficiency, attempting to result in a suntan rather than a burn. Tanning salons also state that UV radiation is needed for manufacturing of vitamin D. Vitamin D certifies that a constant level of calcium remains in the blood and controls its absorption. However, vitamin D is also found in foods such as dairy foods, cereal, and fish, and it takes far less UV radiation to obtain the necessary amount of vitamin D than it does to get suntan. Winter depression, also known as cabin fever, is from lack of serotonin. Affects people of all ages, including young children. It is believed that approximately 6% of the population suffers from winter depression in some form or another. Women seem to suffer more than men. Studies have shown that 5 to 7 minutes a day in a tanning bed can help elevate these symptoms. Recent studies show that individuals who live in high areas where the weather changes from one extreme to the other suffer from worse symptoms. They may be moody, have less motivation, get sick more often, not able to focus on their goals, and perform poorly at work. More severe cases involve the person withdrawing from others, not eating, and having trouble sleeping. Because of exposure to sun, tanning beds, and sun lamps, the number of skin cancers has increased dramatically. It has been predicted that this year more than 1 million new skin cancer cases will diagnose. Also, malignant melanoma can be fatal if not detected early. This year in the United States, 38,000 cases and 7,300 deaths are anticipated. So why are people not complying with the warnings? Why are people not changing their skincare regimen? Perhaps the public is not fully aware of the harmful effects of UV radiation. Dr. Eminette stated that the most of his skin cancer patients are over 50. He also reports that lately more teenagers have become victims, and that this was probably due to the fact that now more than 2.5 million people are using tanning bed equipment daily, mostly teens. Although benefits do exist from choosing to use tanning beds over sunbathing, tanning bed industries have failed to mention many important and harmful risks of tanning equipment. The long-term effects of UVA radiation far exceed the short-term effects. The short-term epidermal effects and trust should be placed in the hands of scientists, researchers, and doctors. Therefore, the conclusion can be made that tanning beds can cause cancer. Scientists also agree that the best method of modification of potential harmful sun behaviors is to educate people of the risk of acquiring melanoma and to eradicate the perceptions of risk. Today I talked to you about the hazardous effects of using a tanning bed and the role UVA and UVB play in these effects. I have also informed you about skin cancers, eye diseases, and other uses of tanning beds for medical purposes. I have brought forth medical and clinical research and studies showing that tanning beds are hazardous to your health, and if you need to use them, do so in moderation. I am hoping that with the information that I've given you today that you'll walk out of here with a better understanding of what the effects are to your body by using a tanning bed. So the next time you see the person walking out of the tanning bed beet red, you'll be able to give them a warning of what they are doing to their body. Or if you yourself plan on tanning in the future, you will have the information that you need to make a logical, informative decision. Because I have proven today that tanning beds are hazardous to your health.